Okay, so the next technique we're going to go over is one that you can either use for a piriformis stretch or also for an out flare in the pelvis. And so what that means is that if your pelvis is sitting like so, the one side might be pulled out further as far as that ASIS is compared to the other side. But this is also a great one for your runners as well as your bikers to do on friends and family other than your pregnant patients. So to do this one, what you're going to do is you're going to flex up their leg. Now this kind of depends on how pregnant they are. Of course, the further they are in their gestation and the larger their abdomen is, you may not be able to flex them as much. But initially try and flex them up to at least get about a 90 degree in that knee, okay? And so what you're gonna do is from this position, you're gonna push them over until you start to feel that it's tight and a little bit harder to push them over. Now she's pretty flexible, so I'm going pretty far, but in some of your patients, you may not be able to go, it starts to feel tighter before then. From this position, I'm holding onto her foot. They can rest that foot down if you want to, but I usually hold it for most of my patients. And then from here, we're gonna do that same technique where I'm gonna have you push your knee out towards me. And again, it's only about 5 to 10 pounds pressure. And we're gonna do it for about 5 seconds, okay? So you see, I'm just resisting her. And 5, relax. And when she relaxes, I try and stretch that just a little bit further, okay? Do that again. And relax. And one more time. And relax. I'm going to do a final stretch and then bring her back to a neutral position. Now, you can do this one on both sides if you're not really sure which side to do it on. It's not going to harm them. And most of my patients, I teach them how to do it and tell them it's totally fine to do it on both sides. To teach them how to do it, you just have them bend up their own knee to their own comfort, grab their knee with their hand, and again, they're going to pull it over until they start to feel that tightness kind of happen. And then at that point, you're going to resist it with this hand, but push your knee back into your hand like you're trying to bring it out towards me for about 5 seconds. Relax, and then take it further. Now, I also will tell my patients if they want to add a little bit more to that, when they take it over into that final stretch, they can actually put their own hand on their sacrum, and as you pull it over with this hand, you can push it a little bit more on your sacrum, this motion, and that just adds a little bit more of a stretch down to that lower back and that SI joint as well. Okay? Perfect.